So welcome back, friends. Like in last video I told you about this case where we had a boy coming, 5-year-old boy coming for routine checkup with his mother, who is smaller than his classmates, and he has protuberant abdomen. There is hepatomegaly, but there is no splenomegaly. Ketones are present, ketosis is present, glucose is mildly low, lactate and uric acid are normal. So what can be the diagnosis? मैकेडल इज रिलेटेड टू मसल. पॉम्बी तो नहीं हो सकता. वॉन गिरके में वी हैव एलिवेटेड लैक्टेट एंड यूरिक एसिड लेवल, सो नॉट दैट. Cory's and there has no significant the clinical features are not matching with Cory's disease. There is no limit dextrin. So the answer is Hirsch's disease. Okay, like that you have to rule out in the exam. That is a and important factor about Hirsch's disease is there is ketosis present. So ketones body are present means it is related to Hirsch's disease. There is protuberant abdomen, there is hepatomegaly seen, and the lactic and uric acid levels are normal. Okay, in Hirsch's disease, this is an important feature. Also very important thing, smaller than his classmate, height will be reduced in Hirsch's disease. 7th MCQ, that is the last MCQ we have here. There is an athlete, 19-year-old athlete, exercise induced muscle pain and fatigue. Like patients with mechanical disease, he shows elevated creatine kinase and post-exercise myoglobinuria. However, there is unusual features, two unusual features. There is symptoms worsen after the intake of high carbohydrate meal, and peripheral smear shows compensated hemolysis with elevated reticulocyte count. There is hemolysis with reticulocyte count. There is high carbohydrate meal intake. Okay, now biopsy of the muscle was performed, then there is accumulation of normal structure glycogen. Which of the following describes the most likely underlying biochemical defect? So this is not related to dextrin, this is not related to any glycogen malformation kind of glycogen storage disorder. So it is mostly related to some other phosphofructokinase enzyme, which can be called as phosphofructokinase enzyme. So that will be present in which kind of glycogen storage disease? So you can see in this there is a muscle involvement, there is high carbohydrate, hemolysis, and reticulocyte count is elevated. So all this is present in Taury's disease, which is also called as the glycogen storage disease 7. Okay, so that Taury's disease may we have phosphofructokinase enzyme, which is the deficiency of an enzyme that is allosterically inhibited by, which is actually inhibited by citrate and ATP. C. Out of the fin phenomena is seen in McArdle's disease, sugar helps. In Taury's disease, high carb meal increases the blood glucose and insulin, which lowers the blood-borne free fatty acids. Since the muscle cannot use the glucose due to phosphofructokinase block, the patient actually feels worse. This is called as the out of wind effect. ठीक है, इसको आउट ऑफ विंड इफेक्ट बोलते हैं. मैकार्डल्स डिजीज में शुगर हेल्प कर लेगा, मगर टाउरीज डिजीज में बिकॉज ऑफ हाई लेवल ऑफ कार्ब्स मील देयर इज इंक्रीज इन द ब्लड ग्लूकोज लेवल एंड ऑल्सो इंसुलिन. इंक्रीज इन ब्लड ग्लूकोज मीन्स देयर इज इंक्रीज इन इंसुलिन ऑल्सो, बिकॉज ऑफ विच द ब्लड के अंदर का जो फ्री फैटी एसिड है इट इज reduced. Because of which the muscle cannot use the glucose due to the kinase block. The patient will feel even more worse after eating high carbohydrate meal. There is hemolysis also. Why is there hemolysis? The M isoform of phosphofructokinase is found in both the muscles and the erythrocytes. Now this phosphofructokinase का enzyme का ना एक isoform is present, which is present in both muscle and erythrocytes. Partial deficiency in the red blood cells lead to mild hemolytic anemia, seen here, a clinical feature differentiated from McArdle. So hemolysis is seen in McArdle's disease, but it is not seen in hemolytic anemia is seen in Taury's disease, but it is not seen in McArdle's disease. Okay, because of the M isoform of phosphofructokinase present in the erythrocytes. Next, there is allosteric regulation. Phosphofructokinase 1 is famously inhibited by ATP and citrate, activated by AMP and fructose 2,6 bisphosphate. Inhibited by ATP and citrate, whereas activated by AMP and fructose bisphosphonate. So these are the important factors about Tauris disease. You have to remember this. Inhibited by ATP and citrate, phosphofructokinase 1, activated by AMP and fructose 2,6 bisphosphonate. We have few genetic diseases also, which we will look in the next video. Till then, stay tuned, keep learning and studying and doing clinical questions. Till then, bye bye.